Fantastic. So thank you so much for your presentation, Jennifer Carroll from the University of Washington. Can you really quickly, in 2 sentences, summarize the point of your paper?
So I look at the popular narrative of a very famous sort of local hero volunteer by the name of Lisa Shaposhnik, and I look at how her story tells us things about the way in which people were included into the narrative of Maidan, into this new society that people felt that they were building, and also how that sort of shapes exclusion as it happened, not necessarily as a consequence of the revolution, but just as a consequence of society and the way those patterns played out for different people involved in different parts of the protest.
Fantastic. And I know you actually didn't go to Ukraine specifically to look at Maidan. So can you relate this to your larger project?
So I was in Ukraine to conduct research on methadone maintenance therapy, patients who are addicted to opiates and are on the substitution program, much like the patch for cigarettes, something of that nature. And it was fascinating to me. One of the things I talked about in my paper today was this narrative of the normal life and things that people thought that they would achieve if they associated with Europe, or if Yanukovych was booted from office and they could rebuild political society and civil society. And that was fascinating to me because it was something that had been a major component of the interviews that I had had with methadone patients, ranging all the way back to 2 years before Maidan even began. And it was amazing to me that I said people are perceiving of the life that they want to lead in the same way, whether they're in the clinic, whether they're in the fields, whether they're within the barricades, except that within the popular imagination of the protest, some people's formulation of that beautiful life was acceptable and celebrated, and other people's were rejected out of hand for a lot of different complicated social and moral reasons. So I try to unpack all of those things.
Yeah, so in other words, living normally actually means that some people aren't living normally and has a sort of exclusionary aspect to it. Can you talk a little bit about how you became interested in Ukraine to begin with?
Yes, so I decided to go back to grad school many years ago because I was working in harm reduction in the United States. I was volunteering at needle exchanges, and I was really impressed with the way in which this program sort of thought outside of the box. It was not an evidence-based policy when in a world where evidence-based policies were sort of taking off. And I did a master's program at Central European University in Budapest, which was wonderful and gave me an opportunity to do research. And I was very green. I wasn't sure what to do, and I saw that there was a growing epidemic of HIV in Ukraine that a lot of civil society was building around. They had sort of Western style, for lack of a better word, needle exchanges and methadone programs there. I visited some of these places, and if not for the Russian on the wall, you'd think you were in Denver or Vancouver, San Francisco. So I took an opportunity to do a very short project there, and I was so deeply impressed by the compassion and creativity and innovation of those programs there that 7 years later I'm still not done asking questions and learning from the people that run these programs. So that's what continues to motivate me to go back.
And is this specific to Ukraine? I mean, do you think you'd find these same needle exchange programs or addiction therapy programs elsewhere throughout the post-Soviet space, or is this really a Ukrainian story?
I think methadone is particularly a Ukrainian story, and this is again very relevant to what's happening now, in that a lot of these programs, however you feel about them, do have certain social and medical consequences, and they are illegal. They've actually been forbidden in the Russian Federation. Even the medications that are used for these programs cannot be imported. So we've actually seen in Crimea the institution of Russian laws and Russian drug control laws in a place where these therapies were once available. And I think what we're going to see is how very fragile some of the public health advancements that were made in the last decade in Ukraine really are. So I think it's yet another situation in which Ukraine is doing things that are very unique, and we are seeing that uniqueness sort of ricochet back and forth in the politics, in the geopolitics of the area, not just the health politics of the area.
And where do you see your work going? Do you see yourself staying on Ukraine or moving outside the geographical borders?
Well, I think I will continue to be interested in Ukraine for a very long time. Like I said, I am deeply impressed with all of the people that I meet there, and I learn so much. On a much broader scale, though, I do want to look elsewhere. I'm interested in, as I said during our discussion, I'm interested in the stories that people tell themselves about themselves, the story that we tell ourselves about ourselves and what we're doing. So to that end, I'm looking now into ways in which we define progress. How do we define the success of a program? Because I've seen so many incredibly skilled and talented and successful clinicians look at me and say, oh, you could find lots of ways to tell me that my program is a failure. But they obviously believe that, and I also believe that they're doing something very successful and very right. So Latour, I believe, and in hacking were the two people who really started talking about coordination. In science, you must coordinate your outcomes, coordinate the things that you produce. And is that coordination innovation possible from like a global UNAIDS, global fund kind of level, all the way down to small nonprofits that are run out of a basement apartment? And how do those things promote or stifle innovation in a public health level? Because these are, while they're broad, discursive questions, they are questions that fundamentally impact the lived daily lives of so many people.
Great. Thank you so much.